Has someone so close to your heart started demonstrating minor but concerning changes during the past year? Many of us believe that death occurs suddenly in old age, although the body frequently sends subtle signs months, if not years, before the end of life. The problem is that because these signs initially appear to be minute, they are simple to ignore. It's only in hindsight that families realize the clues were there all along. However, by then, it's frequently too late to get ready and to give those last moments any real significance. In this video, we'll explore 5 key signs that frequently appear about a year before an elderly person passes away. Be sure you don't skip sign 4, because most seniors tend to overlook that sign. Some of these might be changes you've noticed but dismissed as just part of aging. Others might seem insignificant but actually reflect the body's gradual decline. Recognizing these signs early can help you provide better care, create meaningful memories, and, most importantly, ensure your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, because understanding these 5 signs can help you prepare emotionally and practically for what lies ahead. When you know what to expect, you won't be caught off guard. Instead, you'll be able to make the most of the time you have left with those you cherish. Let's dive in. Sign 1. Extreme fatigue and weakness. One major change in the year leading up to the end of life is profound, unrelenting fatigue that doesn't improve with rest. This isn't just feeling tired after a long day. It's an overwhelming exhaustion that makes even simple tasks feel impossible. Getting out of bed becomes a struggle. Walking across the room takes effort, and daily activities like cooking, dressing, or even talking start to feel exhausting. This isn't normal aging. It's a sign that the body is conserving its remaining energy. As organs slow down, the body prioritizes what's most essential. The heart doesn't pump as strongly, circulation weakens, and muscles receive less oxygen. This is why many elderly people in their final months feel weak, unsteady, and unable to maintain their usual routines. Metabolism also plays a role. The body is designed to produce and use energy, but as it prepares for its final stage, that energy is redirected. Instead of fueling movement, the body shifts toward preservation. This is why someone in decline may sleep more, need longer naps, and find it harder to stay awake for extended periods. Some may experience sudden energy drops, fine one moment, completely drained the next. The emotional toll can be just as challenging. Many seniors who once prided themselves on their independence begin to feel frustrated or embarrassed that they can't do what they used to. They may withdraw from conversations, avoid social events, or stop engaging in hobbies not because they don't care, but because they simply don't have the energy. This can lead to a cycle of isolation that accelerates their decline. For families, watching a loved one go from active and engaged to tired and withdrawn can be heartbreaking. It's easy to assume they're just being lazy or need to push through it. But forcing activity won't help. What matters most is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. If you notice a loved one experiencing deep, ongoing fatigue that doesn't improve with rest, take it as a sign that their body is undergoing a significant change. This is the time to treasure conversations, create moments of peace, and support them without expecting too much. Because in the end, what matters most isn't how much they can do. It's that they feel loved, understood, and at peace. Sign 2. Increased confusion or withdrawal. Emotional withdrawal is another common sign. Someone nearing the end of life often loses interest in socializing. You may notice them talking less, engaging less, or spending long periods in silence. It's not that they don't care about their loved ones. It's that their brain no longer processes emotions and interactions the same way. Conversations become exhausting, loud environments feel overwhelming, and many seniors retreat into their own world. Mood and behavior changes may also occur. Some people become more irritable, anxious, or easily frustrated. Others seem unusually calm, detached, or uninterested in things they once cared about. This isn't just a personality shift. It's often the brain adjusting as the body declines. As mental function slows, emotions become harder to express, and the person may stop reacting the way they used to. For family members, this stage can be especially painful. Watching a loved one lose touch with reality or withdraw emotionally can feel like losing them before they're actually gone. But it's important to remember that this isn't something they can control. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are. Speak gently, offer comfort, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, confused, or withdrawn, don't ignore it. These are often early signs that the body and mind are preparing for the final transition. This is the time to be patient, cherish quiet moments, and focus on making their surroundings feel safe, familiar, and peaceful. Because even when words fade, love and comfort can still be felt. If you're still watching this video and finding these insights valuable, please comment more below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Sign 3. Significant weight loss. One of the earliest and most telling signs that someone may be entering their final year of life is unintentional weight loss. At first, it might seem minor. A belt that needs tightening, clothes that fit looser, or a fading appetite. Many families brush it off as a natural part of aging. But the truth is, losing weight without trying is rarely a good sign. It often indicates that the body is no longer absorbing nutrients properly. Muscle mass decreases and vital systems begin to slow down. While some muscle loss is normal with age, rapid weight loss suggests something more serious. The body might struggle to digest food or process protein, leading to muscle weakness. This loss of strength doesn't just make movement harder, it increases the risk of falls, weakens the immune system, and makes infections more likely. Another factor is a change in appetite. Many elderly people simply don't feel hungry like they used to. Their sense of taste diminishes, food loses its appeal, and they may start skipping meals or eating smaller portions. This isn't just a preference, it's a natural shift. The body, sensing its decline, no longer signals the brain to seek food as often. The result? Less energy, less strength, and a gradual decline in overall health. Underlying medical conditions can also contribute. Weight loss is a common symptom of chronic illnesses, like cancer, heart failure, or kidney disease conditions that may develop long before more obvious symptoms appear. Even depression or memory loss can lead to reduced eating, creating a downward spiral where the body isn't getting the fuel it needs. Some families try to address the issue by encouraging their loved one to eat more, offering favorite foods, or adding protein shakes to their diet. But if weight loss continues despite these efforts, it's important to recognize that the problem isn't just about food. It's the body preparing for a larger transition. At this stage, forcing large meals may not help. Instead, focusing on comfort, easy-to-eat foods, and hydration can make a bigger difference in maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This isn't just about physical appearance, it's the body sending a message. Understanding that message now can help you prepare for the road ahead with clarity, compassion, and the ability to make every remaining moment count. If you're still watching this video and finding these insights valuable, please comment enjoying this below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Sign 4. Frequent infections and slow healing. As the body begins to shut down, one of the clearest physical signs is a weakened immune system. You may notice that someone who rarely got sick before now catches every cold, flu, or minor infection that comes their way. What used to be minor illnesses now take much longer to recover from. Even small wounds, like cuts or bruises, heal more slowly than before. These changes aren't random. They're signs that the body can no longer protect or repair itself as it once did. Repeated infections, such as pneumonia, urinary tract infections, UTIs, skin infections, or oral infections become more common as the immune system weakens. Many families assume these are isolated illnesses, but when they occur frequently or take longer to heal, it's often a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective. The person may need stronger medications, longer recovery times, or multiple rounds of treatment for infections that were once minor. This happens because, as blood flow slows and organs weaken, the body simply doesn't respond to treatment as well as before. Chronic wounds are another concern. If small scratches, sores, or bruises don't heal well or keep reopening, it could mean that blood circulation is compromised. Poor circulation means oxygen and nutrients aren't reaching the skin and tissues properly, making healing much slower. Bed sores, especially for those who move less, become a serious risk and can lead to dangerous infections if not carefully managed. What's even more concerning is that infections in the final year of life often don't present as expected. Instead of a high fever, an elderly person may simply seem more tired, confused, or less interested in eating. In fact, a sudden decline in mental awareness is often the first warning sign of an infection, even before other symptoms appear. Recognizing these changes early can make a big difference in how much comfort and care a person receives in their final stage of life. For families, watching a loved one go through repeated infections can be both frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping that one more round of antibiotics or another hospital stay will solve the problem. But at a certain point, the focus often shifts from curing to comforting, ensuring they stay hydrated, keeping their skin clean and moisturized, and reducing stress on the body can do more for their well-being than another round of medicine that only adds to their suffering. Sign 5. Major changes in breathing or circulation. One of the clearest signs that the body is nearing its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one breathes more slowly or shallowly than before. Sometimes they might pause between breaths, or their breathing might become irregular, speeding up and then slowing down unexpectedly. Some people experience Cheyne-Stokes respiration, where deep, quick breaths alternate with long pauses. These changes may start subtly, but become more noticeable over time. Another common sign is weaker circulation. You may notice that their hands, feet, or even their nose and ears feel cold to the touch. Their skin may look pale, bluish, or have a mottled appearance, especially around the fingers and toes. This happens because the body is focusing on sending blood to vital organs and reducing circulation to the arms and legs. It's a clear sign that the heart isn't pumping as strongly as before. Some people also experience more shortness of breath, even with small movements. Simply sitting up, talking, or changing positions might make them feel out of breath. You may notice them breathing through their mouth more often, or they may suddenly need to pause and catch their breath while speaking. If they were once able to walk across the room easily, but now struggle, their lung function may be weakening. In some cases, fluid buildup in the lungs can make breathing harder. This may cause a constant cough, gurgling sounds, or a feeling of tightness in the chest. Many people assume it's just congestion from a cold. But in elderly individuals nearing the end of life, it's often a sign that the lungs are failing. Lying flat may feel uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to breathe more easily. For family members, seeing these changes can be scary. It's natural to want to help, to encourage them to take deeper breaths, or worry that something serious is happening, but in many cases, this is just the body's way of slowing down. There may not always be a way to stop these changes, but there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease discomfort. In some cases, medications or oxygen therapy can provide relief, but the main goal shifts to comfort rather than trying to fix the problem. If you notice these signs, changes in breathing, cold hands and feet, or a bluish tint to the skin, pay attention. These are often signs that the body is conserving energy and circulation is slowing down. This is a time to be present, offer reassurance, and create a peaceful environment where they feel safe and cared for. As we wrap up this video, take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, memory problems, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the year before an elderly person passes away. They may not all happen at once, and they may not always be easy to notice at first, but when you start seeing them, it's a sign that the body is preparing for its final stage. For many families, these changes can be hard to accept. It's natural to want to fight against them, to encourage a loved one to eat more, move more, or push through exhaustion. But sometimes, the best thing we can do is listen to what their body is telling us. Instead of trying to stop the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about being afraid of death. It's about being prepared for it. When you recognize these changes early, you can provide better care, make important decisions ahead of time, and ensure your loved one's final months are filled with love and dignity. This is a time to cherish moments, share memories, and remind them they are loved and not alone. If you're noticing these signs in someone close to you, take a deep breath and remember, you're not alone in this journey. Many families have gone through this. And while it's never easy, knowing what to expect can help you find strength, patience, and peace. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share something you learned today and how you plan to use it in your life. Your thoughts matter to us, so don't hesitate to share them. Reading your comments gives us motivation and encouragement. If you found this video helpful, please like, subscribe, and share. Your support helps us continue creating valuable content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.